In this video, I'll be demonstrating a stretch to the suboccipital muscle group. You can see here in the black box the left suboccipital muscle group, and there's also the right group over here, and each one resides just below the posterior aspect of the occiput on the upper cervical spine. Each of the suboccipital groups contains 4 muscles. In orange here is the rectus capitis posterior minor. In blue, rectus capitis posterior major. In red, obliquus capitis inferior, and in green, obliquus capitis superior. You would obviously stretch the suboccipital muscles when they're tight, and you can often tell that they're tight via palpation. They'll be tender to palpation and often be flared out in this area just under the occiput in the upper cervical spine. Tight suboccipital muscles are associated with upper cross syndrome, chronically poor posture, especially with excessive cervical protraction, stress and anxiety, and in individuals with chronic pain. The suboccipital stretch is typically done in the seated position, and it can be applied bilaterally or unilaterally. Bilaterally meaning we stretch both suboccipital groups at the same time, unilaterally meaning we bias the left side or we bias the right side for stretch. Let's first take a look at the bilateral stretch, which is lighter and less intense. To perform this stretch, the patient's going to place one hand behind their head on the external occipital protuberance. This is going to be my right hand. This will be hand 1. And then the other hand will be placed on the chin. This will be hand 2. Now hand 1, which is on my external occipital protuberance, is going to apply an anterior directed force in an attempt to tilt the head forward. But then hand 2, which is on my chin, is going to try and push the chin posteriorly into a chin tuck position. We're essentially trying to push the neck into cervical retraction. Remember, the suboccipital muscle group facilitates cervical protraction. So if we want to stretch those, we should facilitate cervical retraction. Let's take a look at that. Now, while in this position, I can also activate my deep neck flexor muscle group, which is the cervical retractors, to further relax the suboccipitals via reciprocal inhibition. And in any case, I'll hold that position for 30 to 60 seconds. Now we're going to take a look at the unilateral or biased suboccipital stretch. This one is going to be more intense because we're focusing all the stretch on one side or the other. Now the first step is that the patient's going to side bend their neck in one direction approximately 20 degrees. Okay? And the rule is that the stretched side is in the opposite direction of the side bend. So here I'm side bended to my right, which means I'm going to be stretching the left suboccipital muscle group. And from here, the stretch is performed identically to how we did the bilateral stretch. Hand 1 is going to be positioned behind my head on the external occipital protuberance, and then hand 2 is going to be positioned on my chin. And once again, hand 1 is going to apply an anterior force to tilt the head forward into flexion. Hand 2 on the chin is going to try to push the chin posteriorly into a chin tuck position. Again, we're trying to facilitate cervical retraction, and we can also activate the deep neck flexors in this position to further relax the suboccipital group via reciprocal inhibition. And I'm going to hold this stretch anywhere between 30 and 60 seconds on this side. Now, generally speaking, if one half of the suboccipitals are tight, the other half are also going to be tight. So we want to make sure to stretch the other side. So we do the same thing in the other direction of side bending. So there I'm side bended to my left. That means I'd be stretching my right suboccipitals. And I would hold this position also 30 to 60 seconds. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.